Hi everybody, I'm Joyce, your moderator for today. Can you guys hear me? If you guys can hear me, can you give me an okay? Right. Okay, let's try. Hi everyone, I'm Joyce, your moderator for today. Thank you all for spending your evening with us to understand what decompression sickness is, why is it important, and how one can seek treatment for it. Diving puts considerable stress on one's cardiovascular system, ears, and lungs. As a leisure diver myself, we might not understand the magnitude decompression sickness can cause or the increased risk of diving accident it exposes us to. We are pleased to invite our special guest, Dr. Clement, to share his vast knowledge, experience, and insights with us. A short introduction to our special speaker, Dr. Clement. He is a hyperbaric occupational physician, wound care practitioner with many years of international training and experience. He has served as a diving medical officer in the Malaysian Armed Force for 15 years. He was then transferred to Hospital Tuanku Mizan KL in 2012 as he continues to treat diving cases in West Malaysia. As his passion continues to grow in helping those in need, he opened his first private clinic and started his hyperbaric facilities in 2015 to treat more than just diving patients. He is also a panel member of Diver Alert Network, DAN for short. Starting from 2021, Dr. Clement is privileged to be to be in charge of the emergency hotline where he can guide the do and don'ts during an emergency and what to do when you are even from the island out. Without further ado, I would like to pass the floor to Dr. Clement, but before that, we encourage the audience to ask questions. Hence, we will be able to post your questions in the chat box below, and we will try to cover as much as we can during the Q&A session with both Dr. Clement and our operation manager, Chris. Over to you, Dr. Clement.
Okay, hi everybody. I think some of you have met me before, and then some of you have not. So it is an opportunity for us to get to know each other in this platform, even though we cannot be together. Actually, we wanted to start organizing some event in the center here, but then because of MCO and emergency law, so we cannot. But at least we can share something and some knowledge over the online platform. So I'm Dr. Clement. Today, we're going to talk about decompression sickness in divers. Okay, so diving has started about 4,500 years before Christ, and people dive for food those days. And now we don't dive for food anymore, we dive for recreational purposes and occupational purposes. So what actually is decompression sickness is there is too much nitrogen bubble in the blood circulation, and then when it is too much in the blood circulation, it spill over and ended up in the joint space the tendon and the muscle. We are going to tell you and share with you about the symptoms, the treatments for decompression sickness, the risk factor, what are the things that make you more susceptible to decompression sickness, the challenges in getting treatment, and what hyperbaric one can offer. So decompression sickness, what are the symptoms? The most common symptoms that present to the instructor or the diving doctors when someone develops decompression sickness is joint pain. Joint pain and tingling or numbness in the arm or the leg. They are the top popular symptoms that you can get or someone can get when they develop decompression sickness. This is something people always overlook, the extreme lethargy. This kind of tiredness is different from the usual type of the tiredness that you experience after a heavy gym workout or a difficult badminton game or something like that. The lethargy is coming internally, and you just feel that you are very tired. and you have never experienced this kind of tiredness before. So when this thing happens, you really have to be suspicious and think of decompression sickness, especially after a dive. People can get headache, dizziness, and of course, these two symptoms are common symptoms. Anybody can get any headache at any time anyway. So headache itself, you cannot regard it as a symptom. But if you have other combining symptoms like what I've described above, then you have to be even more suspicious. Difficulties in breathing, it is one rather serious sign after you come out from a dive. So when you have this problem, you really have to tell your instructor or to bring your student to get a medical opinion as soon as possible. Skin rush, itchy skin can happen, and I'm going to show you some picture. Loss of consciousness and seizures are serious signs. They are not only decompression sickness, but also arterial gas embolism. These are some of the common skin features when someone develop decompression sickness. When you don't have it, it doesn't mean that you do not have decompression sickness. But once you have it, you are pretty sure that you are having decompression sickness, especially after a dive. This kind of sign is called cutis marmorata, and I've just seen one end of last year. For the diving instructor in the island or wherever you are diving, if you have the suspicion that someone is having joint pain or muscle ache or whatever, stop diving. So this sounds like a basic thing to do, but then sometimes we may overlook it, and then we think this is something else. Contact your diving doctor to be ascertain this is a decompression sickness or not. And then if the doctor has decided this is a decompression sickness, then you need to make arrangement to send your student to the recompression therapy as soon as possible. If the patient is unconscious, lie them flat. You don't want to raise them. You don't want to raise their head. And the reason why is because we do not want any bubbles to go up the brain, because the bubbles goes up, remember? So if anyone is unconscious, we do not want the bubbles to go up further to the brain. So rest them with minimal movement. And one of the core treatment is oxygen, of course. So in the dive center, you always have to know that where is your oxygen located. And once you suspect that your student has decompression sickness, you can start the oxygen almost immediately. Hydration is very important, and also based on the medical calculation, once you have been diagnosed as decompression sickness, you have to increase your hydration. And the reason why we want to increase your hydration is because we want your blood volume to be increased. So when you have a higher blood volume, the blood flows better. So when your blood flow better, what does it mean? It means the blood can carry the nitrogen bubble back to your lung better, and you can eliminate the nitrogen bubble faster. That means it also means that you will recover faster. So how much is recommended? Based on the calculation of an 80 kilo person, the person need at least 2 to 2.4 liter of water per day, sipping if he can drink. So 2.4 liters is one big mineral water, one big mineral water bottle is 1.5. So two together is already 3. So if you can finish 2 big bottles of mineral water, then you are already achieving the hydration target. The other thing is no hot shower. There is a reason why hot shower is not encouraged after a dive. No flying after diving, even if it is a non-decom dive. So in the recompression chamber, what is the role of a recompression chamber and what does it do? Number one, the pressure inside the chamber reduce the bubble size. So if you have a expanded bubbles stuck in your blood vessel, and if you go into a hyperbaric chamber and the pressure itself will compress the bubble, when the bubble becomes smaller, it can start to travel again rather than getting stuck in that particular vessel. So hyperbaric chamber, the word hyperbaric means high pressure, is used to compress the bubbles so that bubble becomes smaller and it can flow with the blood and come back to the lung, and then you breathe it out. So second function of the recompression chamber is to remove the use oxygen to remove the bubble. Well, we cannot have nothing to push the bubble away. So we got to have a high concentration of oxygen to move the nitrogen bubble out. And then the third thing is the oxygen itself can oxygenate the hypoxic tissue. Once the nitrogen bubbles are stuck in the blood circulation, it stops the oxygen from getting through to your normal cells. So your normal cells are very hungry for oxygen. So once these bubbles are removed by oxygen, the oxygen itself can oxygenate the hypoxic, the oxygen hungry cells. Recompression table. We use the well-researched and well-studied and well-used Royal Navy table or the US Navy diving table to treat divers. So the reason why these two are chosen is because they are the most extensively researched, studied, and also proven to be effective with the least complication using hyperbaric treatment. So it is also proven to be safe. So that's why in the amongst all the Navy in the world, they always use either the Royal Navy or the US Navy treatment table to treat their divers. Okay, so some of we are going to talk about the risk factor for decompression sickness, and some of which amongst the whole list here, there are 16 which are identified in the typical diving textbook. Some of them you might have known already, and some of them can be modified. We call it a modifiable risk factor, and some of them they are not modifiable. That means something like age and gender. This is something that you cannot do anything about. So if you are an elderly or you are a female, unfortunately, you are at a higher risk, statistically speaking, compared to other divers. Of course, it's not definite, but the probability is higher by statistic. So let's go through every one of them and see if you manage to identify everyone so far in your career as a dive instructor or a diver. Depth and duration, I think this is quite common sense. The deeper you dive or the longer you dive, you will breathe in more air from your scuba tank. So that also tells you you will be taking in more nitrogen. Therefore, your risk is higher if you dive deeper or longer. Individual susceptibility. So say if you dive to the same depth for same duration, and these two persons have the same fitness level, one may get a DCS and one may not. So individual susceptibility is something that you cannot measure, and you just have to look at the outcome and when the two of them surface in the water. So this is something that makes decompression sickness totally unpredictable, and there's no way we can tell who will get it and who will not. Adaptation. This is something about the more you dive, the more you get used to the nitrogen load, and the less likely you will develop decompression sickness. And again, this is a very difficult and impossible things to measure. So it is known to happen, but we do not know how to predict using these factors. Repetitive dive, I think it makes sense to you that if you dive multiple times, the higher the number of dive, the more likely you will get DCS because you are loading yourself with a lot of air, which means nitrogen. So the older the diver, the higher the risk of getting DCS. and obesity. Obesity, the reason why obesity has an increased risk of getting DCS is because nitrogen love to stick to the fat tissue. So when you have more body fat in your body and you go to the same dive with another guy, you are more likely to get a DCS because the nitrogen will dissolve in the fatty tissue. So you are at a higher risk. Dehydration, alcohol, or people who only drink tea and coffee, all these things dehydrate you and increase your risk of getting DCS. If you had an episode of DCS happen before, then you are also more likely to get DCS in the future. Patent foramen ovale is something for the doctors to investigate. If someone developed the second episode of decompression sickness, then it should raise the alarm for the doctors to investigate for this hole in the heart. It is called patent foramen ovale because there is a hole in between the left side of the heart and the right side of the heart. Diving in cold water, hot shower after dive, and exercise during and after the dive will also increase your risk of getting DCS. Fitness is something that is very subjective, not measurable. If you are a fit person, apparently you are less likely to develop decompression sickness. Gender, I mentioned already, is being female, and reverse dive profile is you are diving from a shallower profile to a deeper profile as the number of dive progress. So what we should be diving, how we should be diving is we should dive to the deepest dive in the first day, and then followed by the shallower dive. In that case, it is a correct profile for us to dive in. Flying and traveling to altitude places after dive also increase your risk of getting DCS. Recently, I've treated an instructor who went for a few dive in one island and then hopped to another island and went for another few more days of dive also. He doesn't have any problem on the first day after surfacing, but on the second day when he went to the area of Cameron Highland, then he start to feel something is not quite right in his body. Then he suspected it was a decompression sickness and then came to see me, and then we make the diagnosis, and yes, it was. So prevention. So how do we prevent decompression sickness from happening? Well, very simple. Just don't do all the above, and then do a dive medical. Because in dive medical, other than reducing your risk of getting decompression sickness, we also can, from the blood test and seeing a doctors, can pick up other medical problems that you probably have that you do not know from your blood test. So a blood test, a chest X-ray is what we ask for, and then from this tool, we are able to tell a lot of things, and we can tell you what are your risk in getting into diving activities. So treatment opportunities. So when you develop decompression sickness, where can you go to get treatments? So in the past, for many years, military hospital are the only choice for the divers because in the private sectors there is no hyperbaric chamber in those days. And when I started treating divers in the years of the 2003, only military hyperbaric chambers are available in this country, not even in the Ministry of Health. Okay, the problem with military chambers in this country, because I was from the military and I was a hyperbaric doctor from the military, so I know what are the problems that I was facing at that time, and these are the problems at least that I can share with you and you can be aware of. The number one biggest problem is security clearance for foreign national. You see, a military hyperbaric chamber is situated inside an army camp okay, or in a military hospital. Even though it is a military hospital and there is no national military secret in it, but the Ministry of Defense or any Ministry of Defense in this world are still very careful and very defensive of any military establishment. When you have a foreign student coming to you to be taught in diving and then develop DCS, then you really have a problem if you're trying to get treatment from the military chamber, because the security clearance itself can take up to a day or two. I've done it for many, many times when I was working in Kota Kinabalu, the submarine base, trying to get security clearance for the foreign national, because those days 10 years ago, Sabah was the very, very hot diving spot for international divers. Not only that kind of problem we also had the problem of getting the local people who do not have proper document, like the Bajau Lao, they dive very deep for sea cucumber and things like that. We are trying to get them treated, and yet the security clearance is so difficult. Okay, second point is there is at this moment there is no full-time hyperbaric physicians in the military. After I left and after one of my colleagues left, there was literally no hyperbaric physicians in the armed forces. We have in the armed forces there are some specialists like an emergency physician and also anesthetists. They are specialists in their own field and they take up hyperbaric as their subspecialty, like a second specialty kind of things. So um, most of the time, they have to dedicate themselves to their primary duty to serve as an emergency physician or anesthetist. So they cannot devote themselves to this hyperbaric treatment for divers. So there is another issue there. And then sometimes the hyperbaric chamber will be in service. Every 3 months, there will be a few days the chamber has to be shut down for maintenance and things like that. And every 6 months, another bigger maintenance. And every year, they have to shut down for like a week or two to do full maintenance. So the downtime is something that stop the divers from getting treatment in the hyperbaric chamber in the military. Military uh, hyperbaric chambers are military divers orientated. They are not designed to serve the civilian. So the military people may not have the kind of attitude towards civilian divers. If the military Navy divers get into decompression sickness, of course they are very concerned and keen and want to treat soon and fast and get them into the chamber fast. But the kind of priority is never the same given to civilian divers. So, and even if you are a Malaysian, it also takes time for security clearance. Security clearance is something that need to be done before any person can enter into a military base. So this picture, I just want to show you all the military hyperbaric chambers available in the whole of Malaysia. Kota Baru is not a hyperbaric, it is not a military hyperbaric chamber. It is University Science Malaysia. I think they have one-man chamber up there in the university. They can treat divers there. The second place is Lumut Naval Base. They have a big chamber there, and in fact, it is the biggest in the whole of Malaysia. I think 17 men, if I'm not mistaken. Started in the 90s, and then it was the biggest in Southeast Asia at that time. And in Kuala Lumpur, there is a Hospital Tuan Gumisan Hyperbaric Department where I used to work, and I left the department in 2015. Guess where do we have the highest number of hyperbaric chamber in the whole of the country? It is in Kota Kinabalu. We have the Navy Divers Chamber. in the diving base, in the diving unit in the Navy. We have the hospital hyperbaric chamber in the military hospital there, and we also have ship chambers on board ships in Kota Kinabalu. So there are at least three different separate chambers in Kota Kinabalu because of the submarine operation there. In Sandakan, there is one chamber, and in Sempona, there is a multi-place chamber also. So if you happen to dive in those places, and if you need hyperbaric treatment, so these are the places to look out for. Okay, treatment opportunities. So I have discussed extensively about military hospital, and I was able to tell you all this because I come from the military. That's why I can share all this information with you. Okay, recently, in the past few years, we have a number of hyperbaric centers exist in around the Klang Valley and also in Kota Kinabalu that I know of. So, but then I would personally categorize all this center into different category. The first one will be a private hyperbaric center with no hyperbaric doctors. And then the second one will be, the first one will be primarily operated by a technician, a hyperbaric hyperbaric chamber trained technician. They can operate the hyperbaric chamber. And then the second category will be the private hyperbaric center with doctors. Okay. What kind of center is this? Is that a doctor is interested in treating patient with diving problem. So they buy a chamber, and then they went for a short course training, like a 1 week or a few days training. Then when the chamber arrived and they set up a center, then when they open door for divers to come, then they are called a hyperbaric centers. And then the last one will be a private hyperbaric center with experienced hyperbaric doctors. Between me and my staff here in Hyperbaric 1, we have a combined 17 years of experience in serving the countries and also various organizations that you are aware of that among us. Let's go through it one by one. We in Hyperbaric 1 have served the international and local recreational divers from all over the world and from Malaysia as well. We have served the Malaysian Navy SEAL, the Pasca. Of course, you know them by the movie that came out last year or 2 years ago. And then we have served the Malaysian Army Commando divers. We have served the Royal Malaysian Navy ship divers. We have served the submariners, the Navy clearance divers, the Malaysian bomber divers, the Malaysian Police Commando divers, the Diver Alert Network subscriber, the Malaysian MRT project tunnel workers. We have also been an emergency standby panel to international smelting plant in Malaysia. And we are also a panel to oil and gas diving contractors. We are also divers to water reservoir diving contractors, and we are also working with the international SOS subscriber too. So in Malaysia, when your student or your friends develop decompression sickness, what are the problems that you will face? Number one, when you develop this medical problem, of course, you will bring the person or you yourself go to a government hospital emergency department. But very unfortunately, in Malaysia, we still have many doctors who cannot recognize this disease. Decompression sickness is something that you need to be trained to learn to recognize. If a doctor have never seen one case of decompression sickness, he won't be able to make that diagnosis. If he's not trained in this area, he cannot be making the diagnosis. Recently, I have one doctor's friend who developed decompression sickness from one of the diving island from the north, came down and stayed in a private medical center. And before he was seen by the doctors in the emergency department, um, she was checked, and then the doctor actually told her that it is not decompression sickness. So why do you need to go into a hyperbaric chamber? But of course, it turned out that the doctors was wrong, and then we actually treated her, and then she fully recovered from the hyperbaric treatment, and she was very happy about the treatment that we provide. So from there, the second problem that someone will be encounter is a delayed diagnosis in decompression sickness. If you do not know how to diagnose this sickness, then how are you going to make the diagnosis? So the diagnosis will be delayed by the doctor seen in the hospital. And a lot of doctors, when they see, even if they suspect this is a decompression sickness, they will spend a lot of time doing a blood test, scan, X-ray, and many other tests. And it may not be necessary in a lot of straightforward cases. When I see a decompression sickness, wait the patient inside the hyperbaric chamber not to delay the treatment and to start the treatment as soon as possible. And then remember in the beginning of the slide, this session, I was telling you that the people need to be hydrated and given 100% oxygen before coming to the hyperbaric chamber. This is extremely important because once you develop symptoms of numbness or pain in around the joint, and if you can start the hydration, the 100% oxygen as soon as possible, then by the time you reach the hyperbaric chamber and start the hyperbaric treatment, your prognosis will be better and you can recover better and you can recover faster. Without the hydration, without the 100% oxygen along the way, say from Tung Mun, you take an ambulance all the way to Kuala Lumpur, and that will take about like 5-7 hours. In that 7 hours journey, if there will be a big difference if you have been hydrated well and if you have been oxygenated well. And then when you come to a chamber here, when we treat you, I think your prognosis or your chances of recovered will be faster and better. So these are very important things. So a delay in sometimes when you go to a hospital, there's a lot of paperwork, and you sit in your bench waiting to be seen, and a lot of times are wasted. So those are the challenges that you may face when you go to a government hospital, because you will be competing with other patients who need more emergency or more urgent treatment. Okay, and then another thing is what makes the recovery difficult later on is if you present late to the diving doctors. It is well known to the hyperbaric doctors that if you present yourself to the hyperbaric doctors more than 72 hours, that is exactly more than 3 days from your first symptoms, those symptoms that you are experiencing, like numbness or tingling or even joint ache, it may follow you for the rest of your life. Then those symptoms can be permanent. So if you don't get yourself treated within the 72 hours window of period. I put up this two last point here because I was working for many years in Sabah, and I treated a lot of the bajau divers. So the bajau divers, they are not so well literate, and then they believe in more traditional belief rather than science and medicine. So when they develop decompression sickness, they will first choose to go for urut, or they even went to see a bomoh. And by the time all those things doesn't work, and by the time they come to me, the damage is quite permanent already. Okay, so after talking about all the problems that we may face, now let me tell you what are the things that the Hyperbaric one can offer to you. I think we are here to offer you a very unique, special type of service that not many people in the market or in the diving industry can offer. The number one thing that we can offer to you is the access to an experienced ex-military hyperbaric physicians and advice over the phone with even with the divers or instructor in the island. So what I'm trying to say is, as long as you have a good telephone reception, even if you are in an island, you can call us. We can advise you what to do after after I have understand the situation of the patient, and on the phone I have to make a decision to see what is the probability of the person actually is suffering from decompression sickness. And once I decided that this is a decompression sickness case, then we will advise you on what to do next. We will advise you to improve the hydration of the patient. We will advise you to get the 100% oxygen for the patient or for the divers along the way when they come here. I will prepare whatever that we need to receive the divers in this hyperbaric center. Then once the divers is here, then we straight away cut short a lot of procedure and put the divers into the hyperbaric chamber as soon as possible. So another good things in the service that we provide to you is we actually take over the medical care of the divers from the start of the decompression sickness. Say if your student tells you that, oh, I have this numbness and joint pain on my left elbow, so you have my number. You can actually, if you're not sure what it is, then you can actually call me and we can start the conversation over the phone. And then literally the medical care of the divers is taken over by us. This may not be important in the past, but it is important in this new era. Nowadays people are very particular. When you are a dive instructor, if you're not sure that this is a medical issue or what kind of medical issue, and you pass this issue to the medical people, then they can help you to sort it out, rather than you taking the risk of trying to manage this patient. And if things doesn't go well, the patient can, or the divers can always come back to you with a lawyer. Actually, I am actually writing a medical report for one of my clients who is a diver, because she felt that she was wrongly advised by the dive instructor when she developed a very bad episodes of decompression sickness. So that's why it's good that if you are a dive instructor or dive master, when you have something medical that you're not sure of, you pass the ball to the medical people and the people who are expert in this area to help you to give the expert opinion to you free. You see, so that is a kind of support that Hyperbaric One can offer. In Hyperbaric One, the location is also ideal. Okay, there is a medical center nearby here, Sunway Medical Center, which is only about like 100 meters away from us. And then if you come to KL, and if you choose to stay in a medical center and covered by your insurance card, you can stay in Sunway Medical Center. Or if not, some of my divers patients, they choose to stay in Sunway Sunway Resort. Okay, so a more comfortable place. If that is a more expensive place for you, there are a lot of Airbnb around here also. In this building where Hyperbaric One is situated, there are many different type of restaurant also. There are Hong Kong food, Chinese food, Korean food, Thai food and many different type of food. So you will never short of choices for yourself. And there is a big supermarket here where you can choose to get your morning breakfast or some snack even before you come to a chamber. So it's very convenient here. The next thing that we offer here is, of course, the paramount issue of safety. We have a full system of a multi-place. It is a full system multi-place hyperbaric facilities tested by the independent hyperbaric engineer and passed for the US Navy diving pressure test. So it is certified safe chamber for hyperbaric treatment. We also can provide you advice on flying after the treatment because after the patient or the divers is passed to us for medical treatment, you as a diving instructor may want to get back to your teaching life and you may not have the time to follow up with the divers anymore. And we will take care of your student or your point on them to fly to a letter on the flight deferment. Say if they have a flight to catch tomorrow morning, and then he or she developed decompression sickness and requiring treatment, I, as a hyperbaric physician, can write a letter to the airline to ask for a deferment without penalties. And most of the time, most airlines are sympathetic enough to grant the deferment and without much issue. Okay, so this is some of the picture of the hyperbaric chamber that we have here. So this is the outside of the chamber, the exterior. This is the control panel, and this is the interior where you can sit down or lie down. And this is a fully air-conditioned aircon, and sometimes it could be a little bit cold also, but we provide you with a blanket. And if you're doing the long treatment table, we have a urinal for people to urine inside the chamber also, because you'll be inside for like 5 hours if you're doing the long treatment table. So we take that into consideration as well. And this is the contact of Hyperbaric one. If anyone is interested to come here to have a visit and have a look at what our facility is like, so feel free to drop by, and then we'll be happy to see you here for an educational visit. Okay, thank you very much.
Okay, so hi, Doctor. Thank you for the informative session together. Right, we do have quite a lot of questions coming from our viewers. Right, one of the questions was, when we are referring to no flying, are we referring to commercial flights? Because as I understand, there are cases where transfer via helicopter evacuation is needed.
Yes, when I talk about flying after diving, I'm referring totally to commercial flight. Transferring with helicopter is something that you need to get advice from the hyperbaric doctors, because the flying height of the helicopter must not be more than 100 meters. So it is not something that can be arranged so easily, because flying at 100 meters is extremely dangerous, because helicopter pilots are not encouraged to do that, because there are low-lying objects along the way and things like that. So that increase the flight risk significantly, safety-wise. So it's totally not advisable. So if possible, because decompression sickness is urgent, but not that extremely urgent. So in the Peninsula Malaysia, most places can be connected by highway, especially to Kuala Lumpur. Even if you are in the northern part of where all the diving islands are, you can still have the window period of time to catch a boat from the island to the mainland, and then from the mainland, arrange the transport, and maximum like 5 to 7 hours, you can reach KL already. So that is still within the good treatment window where you will not suffer from a permanent disability, like what I mentioned. There are other evacuation method, and that is by international SOS. They have a jet that can pressurize the cabin to 1 atmosphere. So it doesn't matter how high the flight can fly, so you will not be further decompressed. But the problem is not everybody can afford that kind of insurance because they are not cheap. Because they promise that insurance, those kind of medical evacuation service, they promise you wherever you are, they will fly to the nearest airport and get you and then fly you out. So yeah, so these are the choices.
Thank you. Another question is from Jeremy, right? How long does decompression sickness symptoms will appear after it dies? So how long does it take before it appears?
Typically, from the textbook description, is usually about half an hour from your last surface up to like a few hours or many hours after that, within like the first day of dive. So, but I have seen some more severe decompression cases where after they come out from the water, uh, with less than half an hour, the symptom all come out. Okay, so how long after the symptom come out when you after you surface shows how severe your decompression sickness is. The earlier the symptom come out, the more severe the decompression sickness, and it means the more nitrogen bubbles are in your body.
Thank you. Another question is, even a dive professional do not develop any sign or symptoms for DCS, do you recommend an annual or quarterly recompression chamber therapy?
You can do that at your free will. The medical profession in the diving side, they usually recommend people to go for treatment when you develop decompression sickness inside in your body. But when you do not develop any signs or symptoms of decompression sickness, you are basically not required to do any treatment. But sometimes people want to do it at their own, so it's up to them.
Okay, thank you, doctor.
Mhm.
Another question is, how many hyperbaric sessions are required for DCS recovery? And we do have a few questions following up as well, right? Do we need to go for a checkup before that?
Strictly speaking, even before you go inside the hyperbaric chamber, you are supposed already to have done every year a diving medical, so that when before you go inside the chamber, we already know that your lungs are fit to go into a hyperbaric chamber. We don't want to wait until you develop a hyperbaric decompression sickness, then we will be rushing you to do an X-ray before we put you into a hyperbaric chamber. In other developed countries, like in Australia, a diving medical is compulsory for anyone who want to go for diving, because when in the diving medicals, we can pick up a lot of disease and to make you fit or unfit even before you start diving. But in Malaysia, we do not have such law. So Malaysia is like you can do anything and semua boleh. So that puts the divers in a more dangerous position. So let's go back to the question. The question asks how many sessions do we need to treat for decompression sickness and for how long? So there are two variables here. Number one, how many sessions? And number two, which type of treatment? There is a short treatment table, 2 hours plus, and then there is a long treatment table, which is about 5 hours, double the time. So we will decide what type of treatment table do you need based on the severity of your symptoms. If you are having very bad symptoms, then straight away we will recommend you a 5 hours treatment table. And how many session do we need to give you that 5 hours treatment table? Depends on your response. And of course, your response depends on what you have done all the way before you reach the hyperbaric chamber, which means along the way, like I say, from the island, are you taking any 100% oxygen to improve yourself even before you come into the chamber? And are you hydrating yourself well even before you reach the chamber? All this affects how many sessions or long table or short table we use to treat you.
Thank you. Next question is, what is the most common complications of hyperbaric oxygen therapy? Is there a percentage of risk?
Every treatment in the medical side, medical treatment has a risk. If you have an appendix, you go into an operating theater. Yes, if you don't do the operation, you will die from the appendix. But if you do it also, it doesn't mean that you do not have a risk. Every time when you go to a hospital and any procedure being carried out, there's always a risk. And the same goes to hyperbaric chamber also. There are a number of risks, and that's the reason why we need to do an X-ray to look at your lung, if you are fit enough to go into a hyperbaric chamber or not, if you have any history of TB in the past, and all those things. But then all these things should have been done when you before pick up diving. You have to do a diving medical, because all these things can be eliminated even before you become a divers, or before you take up a open water diving course. Yes, there is a risk. There are risk for a number of things, but we as a hyperbaric doctor, we will try to minimize it, and also we will try to decide whether or not you are fit to go into a hyperbaric chamber before we treat your disease.
Okay, thank you. We have a follow-up question from Douglas as well, right? He says, hi, Dr. Clement. From the primary assessment, is there any other symptoms that's mentioned earlier? Is there any other methods to check on the patient too? Example, like a dropping on SpO2. And if evacuate via heli, do we need to provide O2 to patient, oxygen to patient? What will be the O2 flow needed?
The O2 flow, you can put it as high flow because you want to get as much oxygen as possible. You can put it between 3 liters to 5 liters or something like that. It also depends on the reserve of oxygen in the tank. Can it last you over the journey or not? You don't want to put a very high flow, and then in the second half of your journey, you run out of oxygen. So all these things has to be taken into consideration as well. Sorry, the first part of the question was?
Is there any other symptoms, which is after mentioned earlier, is there any other one where we can check on the patient?
There is. Decompression sickness is something that you cannot do any test to confirm the patient have decompression sickness or not. Decompression sickness is a diagnosis by exclusion. It is a clinical diagnosis. You cannot do blood tests to confirm it or to help you to decide whether or not this is a decompression sickness. The diagnosis is made based on the examination by the hyperbaric physician and based on his clinical experience. And if he has seen enough, treated enough, then he knows when he see the patient, after talking to a patient and after assess the patient, he will know this is a hyperbaric issue or not, or it could be another different type of issue altogether. He can decide on that.
Okay. Many people actually wonder then how much is it, what's the average cost of a chamber treatment over here?
The average cost of chamber treatment, this one I have to pass it to Chris, and then can Chris answer and let the people know?
Yeah. Can we invite our operation manager over?
Cost.
Many people are asking what's the average cost of a chamber treatment over here?
All right. For medically, for divers, we are actually using 2 tables for treatment. And then if we are doing the long table, it would be about 1,007 ringgit just for the long treatment. And then there's a short treatment, I think it's about around the 2 hours and 45-minute treatment that would take about 1,002 ringgit. And then for other medical that we are doing it using Hyperbaric Chamber, that would be around 400 ringgit per 1.5 hour.
Thank you.
Alright.
Many of our viewers are also curious, where can we renew or get this hyperbaric chamber operating nurse or certification?
Oh, you mean getting the
How do we get
certified
certified?
as a hyperbaric nurse?
Yes.
Wow. I think in Malaysia, my senior colleague in the military in the past, Dr. Lee in Ipoh, he operates a training center there. He can train doctors to become a hyperbaric assistant, hyperbaric technician, and also a hyperbaric nurse. So his clinic is in Greentown, Ipoh. So maybe you can, anyone who are interested, you can make inquiries to him, and he can show you the way.
Great. We have a viewer here as well. Wong is actually asking, is there an emergency contact for Hyperbaric One? And I think, Doctor, you also have shown your number in the slide.
Yeah, it's on the in the slide now. That phone number is the clinic number, and after working hours, I can be contactable in the 014-9520274 number. That one is my it is this number to call. But during working hours, you can call the office and then to see to talk to me to if you need any advice, even when you are in the island.
Nice. Okay. Now we're also going to insurance, right? Does hyperbaric oxygen treatment covered by insurance normally?
Whether or not it is covered depends on what type of policy that you take. Because some people, they take a very basic policy that covers you for basic medical sickness only. Diving is not an ordinary thing that everybody do in their life. So there are some very old insurance policy that doesn't cover because in the old days, diving is not something to be recognized. But nowadays, if you take up an accident, personal accident insurance, and if you develop the decompression sickness, you got to check with your insurance agent before you come to make sure that you are covered. So because again, for the same type of personal accident insurance, there are different insurance provider. So each one has their own policy. And some people, they take a travel insurance, and some travel insurance covers you for that. So it really differs from insurance to insurance. So the best thing to do is to check with the person who sold you the insurance. Don't just make him sit and enjoy the profit that he make from your insurance. Ask him and get him to do the work and let him find out from the insurance provider if you are covered or not.
Right. Okay. We have another question in Facebook, right? What is the percentage of full recovery from DCS? Any possible common side effects come after the treatment?
The recovery rate for decompression sickness is actually very good. So if, for example, you develop this decompression sickness in the island, immediately when you feel the numbness or the pain on any part of your body, you tell the instructor, and then your instructor is good enough to call us and get an advice. Then we will get you into a hyperbaric chamber in the shortest possible time. Within the first day, the most recent case the most recent evacuation that I have received was the lady called me at about 6 p.m. the day before, and then the next morning, which is about like 12 hours later, she's already in my hyperbaric chamber, and then we treated her, and then she recovered fully. The only time where you have the possible long-term permanent disability from decompression sickness is when you present late to us, i.e., more than 3 days after you first experience your first symptom. So what are the common complications from decompression sickness is the numbness and the tingling. In Malay, we call it semut. It's like very numb, these kind of things in your joint. It can follow you for many years, especially during the cold and rainy days, or if you enter a aircon, very cold room, you can suddenly experience this numbness and things like that, and also the joint pain. I also have one patient who developed numbness and tingling at the tip of the fingers, many fingers, and she thought that she already recovered. And then when she joined another activity, which is skydiving, and when as soon as the aeroplane take off to a certain altitude, she start to feel the tingling and numbness coming back in the same location in all these fingers. So the reason why that happened in that person was because when she went to, I told you there were a few categories of medical institution that provide this kind of service. When they went to some of these so-called hyperbaric center, she was not properly treated. She was not well treated, and then there was some remnant or some residual bubbles that are still stuck with her inside her body. So that kind of things can happen.
Okay, then just a follow-up question as well, right? If a person was fully recovered from DCS, is she likely to get DCS even though she has stopped diving completely?
If you have developed DCS and if you stop diving completely, then you will not get DCS again because you'll be staying on land and then uh, at one atmosphere. But if you decompress yourself again, and if your DCS was not properly treated, like what I described in the case that I mentioned to you, that lady had a tingling and numbness in the top tip of her fingers, not properly treated. She has not gone for the next dive, but then she decompressed by going to altitude, by taking up this skydiving, or you go to a mountainous area, then you may feel the same type of numbness and pain on the joint or on the location where you suffer from this DCS before. Yes, it can happen, but if you do not go to altitude places or you do not decompress again, it will not happen.
Right, I think the next question will be for Chris, right? Is it possible to arrange a tour to visit your facility? If yes, then how many people at one time and how much per pax will it cost?
For visit itself, we don't charge any money for visiting. Yeah, but then of course we can arrange. You can DM us on our Facebook. We can arrange that, and then we can set a time where I don't have patients. And then I think during this pandemic, I think if you come in a group, probably about 4 to 5%, that would be more than enough for us to have a tour on this whole place. Yeah.
During this visit, we have to strictly observe the SOP. We do not want this to be a new cluster to develop, so we have to be very careful. Even if Chris is busy, if I am not busy in my clinic, I can actually take over the tour and would love to tell you more about this hyperbaric service that we have, which I think it will be very interesting for you all.
Okay, then many people has also said, right? It seems like we all need to take automatic, whether it's it hydration or even give the patient oxygen, right? Are there any things that this patient can do at home for themselves as well before they come over here?
You mean they already developed decompression sickness? What can they take at home before they come over here? Basically nothing. So when it comes to painkiller, I know you have numbness, I know you have pain. So some doctors or even your family may advise you to take some anti-inflammatory like a Voltaren or an aspirin to reduce the sensation of pain or numbness. But I, as a hyperbaric doctor, strongly discourage you to do that because I know those medicine is good for you, but it also will cloud my clinical judgment. I need to know at your worst time how severe is your pain, and your pain is an indicator of how long and how many sessions of treatment I need to provide to you. Remember, I told you there is no test for us to do to see how bad or how good you have improved. So pain and your numbness and your tingling are the indicators to us. So I cannot have those things absent. Therefore, I will not be able to make my clinical judgment and provide you with the best treatment plan.
All right. So then we also have a few questions from the viewers, right? Saying, does this chamber only treat DCS?
This treatment, okay, if you go to the official website of UHMS, which is Undersea Medical Hyperbaric Society based in the United States, it is the biggest hyperbaric society in the world, and they have listed out 14 medical condition where you can actually go into a hyperbaric chamber and improve or cure those conditions. It is not hearsay, it is evidence-based, and they have done all the study and the research and have already proven those 14 conditions can be treated and recovered or improved by hyperbaric oxygen treatment. And two of them, which are diving related, are decompression sickness for sure, is confirmed. And then the cerebral arterial gas embolism, which is the burst of the lung when you ascend too fast, holding your breath, you burst your lung, and then the bubble travels straight to your brain and give you a stroke. And that kind of this disease, you need to go to a hyperbaric chamber. This is the only chance and the only method of treatment. The other things are you want to improve the chances of success of your skin graft if you're doing a plastic surgery, okay, or you have a diabetic foot ulcer, or you have a radiation burn or radiotherapy, and there's a new wound breakdown, or few more things. You just need to go on the platform and check it out.
All right. We also have another question, right? Without any symptoms, do we need to prepare or provide you any medical documents prior to do this treatment?
Yes, it will be the best. You see, I always need to emphasize the importance of doing a diving medical every year. When you have a diving medicals with you and with us every year, then we know that we already know you and we already have all your records. And if you develop DCS, you run straight to us, we can start the treatment straight away. Instead of you coming to us for the first time and then we have to ask you many questions. We have to get to know you because after you have certain condition of the lung or you had any operation or anything in the past, then going into a hyperbaric chamber may put your life at risk. So the reason, and that's why we need to ask all those questions and to find out more. So in the process, we will be using a lot of time, and that delays the treatment. So going back to the question, if you have any medical documents that will tell us more about your medical condition, that will be the best, and especially a chest X-ray.
Yep. Okay. Thank you so much, everybody, for all your questions. I think that's all for tonight. Yes. Right. Have a good evening, everybody. But before we go, we actually have a small surprise for you for joining our call. We have a small surprise for you. So you can take your pen and paper down, and you can take this code. Can I see the code, please? Oh, okay. So that you can come and have a 30%. It's a gift from us. You get a 30% on your first treatment over here at Hyperbaric 1. The code is give me a minute. HB30T.
Yep.
Yes, let me just double confirm. HB30T. And this will be valid from tomorrow onwards up to 28th of February.
Yeah, if you have not tried what a hyperbaric treatment is like, even if you do not have a decompression sickness, you can come and experience it. using this code, then you will know what is it like, and you know what to expect. And then you'll be able to tell other people or your student about your experience of inside a hyperbaric chamber. In the military, we use a hyperbaric chamber to do training for the divers, the military divers. We call it a dry dive, because it is a dive but without water, so that's why it's dry. So inside there, you'll be able to test yourself whether or not you can withstand pressure in terms of your ears and also in terms of your lung. So it's a good exercise.
All right. Thank you, everybody. Good evening. And I hope you have a great day ahead.
Okay, thank you for joining us, and have a good evening. Bye bye.
Bye.